Good morning, or good afternoon, depending on where you are. I'm Matthew Holt. Thrilled to be here. I'm in Livongo's offices with Glen Tullman, CEO of Livongo, and Dr. Schneider, the Chief Medical Officer. I've been doing healthcare and health technology for around about 30 years. I run the Health 2.0 conference. I've founded the healthcare blog. These days I advise startups at Smack Health. But really, what I'm here today to do is to talk about a whole new concept. You've probably seen the tweets called silencing noisy healthcare over the last few days. And I'm here with Glen and Jenny to talk a bit about how Livongo is going to be doing that. First, a couple of housekeeping issues. Your lines are muted, but you can do Q&A by pressing that button at the top. Looking forward to answering. We have a good portion at the end. Looking forward to answering as many of the questions as possible. And then I'm going to talk to you a little bit about the agenda for the day. I'm going to start with some background about the state of chronic disease and how it's getting worse in America. We'll talk a bit about the myth of more technology and how that's creating noisy healthcare. And then we're mostly here today to hear about Livongo's approach to how to silence that noisy healthcare. They're launching a whole brand new category in health today. And then we're going to have some time for some Q&A. Is that right, Glenn?
Just nothing about the cage match.
Oh, no cage match! Yeah, well, I think Jessica Lamass has been promoting that. Apparently Dave Chase has a good tweet about mud wrestling, but no mud wrestling in this particular webinar, maybe the next one. Okay, fair enough. All right, so where are we? Well, we're in a world where, for America and the world, but in America, roughly a third of the population, a bit more than a third of the population has a chronic condition. And as those of us in healthcare have known for a long time, that drives most of the spend, 75% of the spend. Apart from trauma and other stuff, not too much elsewhere. And it's getting worse. We've put a ton of technology into the system over the last 20 years, something that you're responsible for. And we perhaps haven't made as much difference as we like to make. So I'm going to basically talk to you about, through the course of this webinar, about these issues and how we might be able to fix them. And I think that some of the things we haven't done well is get other technologies that we're seeing elsewhere in Silicon Valley, which is where we are, into the system. Okay, so with that, I'm going to kick it off and introduce Glen and Jenny. Glen was, for many years, CEO of Allscripts, and now is, whoops, thank you. There you go. Many years CEO of Allscripts. June Formal thinks you still are CEO of Allscripts, apparently. Now, since 2014, you founded Livongo. Jenny, you were previously at Castlight, Chief Medical Officer there, but I think joined in 2015 into Livongo. And the last couple of years, you have been really changing the way that people are developing and thinking about how to deal with people with chronic illness, starting with diabetes and now living on. So Glen, tell us a little bit more about Livongo.
Sure, I'd be happy to. Well, over the last 4.5+ years, Livongo started in the diabetes space. And what we did there was try to create something that was new and disruptive, a new experience for people with chronic conditions, starting with diabetes. But it was always going to be more than diabetes, because we always knew that to get someone healthy, you had to focus on everything that was the issue with them. But we started with diabetes, and we've been able to do a few things that are unique. One, to provide proven clinical outcomes that were sustainable over multiple years. So that's number one. Two, you had to also provide sustainable financial outcomes. And many of our customers are looking at this as, how do we get our employees and what we call our members both happier? They have to love the system, number one. Number two, healthier. And number three, how do we save money doing it? And that's always been the promise and the magic of Silicon Valley. And in doing that, we've actually started to put, for the first time, data science to work with a real-world, evidence-based set of information, because we were actually gathering information from people's body. And we know it worked. Why? Because, first of all, our members love us. Net Promoter Score between 62 and 65, which is pretty much unheard of in healthcare.
I'm sure every health plan would be jealous.
Yeah, that and more. That and more. And second, today we have more than 600 clients. Those are our partners, and those are large self-insured employers. Those are 4 of the top 7 plans, the 2 largest PBMs, all of whom have concluded this actually works. and more than 100,000 members who are all connected to the platform. But this started in part because we understood there was a fundamental problem. And the problem was, for 135 million Americans that you mentioned, today healthcare is just not working. And they don't feel a part of it, they don't feel in charge of it. And with all the devices and technology and everything you mentioned, the fact is they aren't any healthier today than they were many years ago without all of that.
And it's getting worse.
And it's getting worse. And there's two reasons that I entered this space. And here's one of them. My son, Sam, was diagnosed when he was 8 years old. He's now 23, and he was diagnosed with type 1 diabetes. And my mother had type 2 diabetes. And what I saw was how difficult we made it for people with a chronic condition like diabetes, but hypertension or many of the other chronic conditions, depression. We made it so difficult for people who wanted to be healthy. And so the goal was, how do we empower people with chronic conditions to live better and healthier lives? And what you see is Sam's progression here, from diagnosis to playing college football to the two of us finishing a century, 100-mile bike ride. And while he still has diabetes, what we've been able to do is make living with diabetes a little bit easier and make it easier for him to stay healthy. And so, again, what we find today, and the reason for this announcement today, is for most Americans, healthcare is noisy. It's confusing, it's complex, and it's very costly. And the idea is that people are just overwhelmed, and they're saying to us, our members, our 100,000 plus members growing to more than 1 million over the next few years, they're saying, please stop the noise, silence the noise, and give us new solutions that will create a new and different kind of experience. So today we're introducing applied health signals. And applied health signals is a new category in the health ecosystem. And really, why did we need to do that? Because there's no category that describes where we're going and where we want to be. Because today, as I mentioned, healthcare is confusing for people. And what they want is clear guidance. They're saying, give us solutions that are actionable, that are personalized, and that are timely. And that's what people want. Second, they're saying, don't give me multiple applications and multiple coaches and multiple people to talk to and more technology. Make it simple. Give me one unified system, one solution, and create an experience for me that makes it easier. And lastly, don't make it so costly that I have to mortgage my house. Right. Because that's what's happening today. And so what we've done is we've created something that Dr. Schneider, that Jenny is going to talk about, and that is an engine to power this new kind of healthcare. And I'm going to turn it over to Jenny now.
So Jenny, before we get to that point, we talked a lot about the consumer experience there. Don't forget there's the other side. We put all these devices and tools into the system. We haven't really equipped the provider side of the equation to deal with, I call it air traffic control, which is what it's called it. I don't know what you would say, but in terms of the system, Livongo is one of those companies in the building the platform to deal with the other half of that. But we're always special to call this. It's a platform, it's a service, it's a new kind of care delivery. So tell us what you're going to call it.
Go ahead, Glenn.
Well, I think that's what we're calling it, applied health signals. And really what we're trying to say is it's not enough to have more devices or better devices. We have those. And so people say, well, are you a device company? And the answer is we have some pretty cool devices, cellular connected scales and blood pressure cuffs and glucose meters, but we're not a device company. And we have some pretty cool data scientists. In fact, if you walk around our offices here in Mountain View, you might see more data scientists than you see software developers, which is pretty unique, but we're not a data science company. And you could look at us and say, are we a coaching company? Because we have certified diabetes educators and all kinds of coaches all around the country who are talking to people 24 hours a day, anywhere in the world. But we aren't a coaching company. And what we've concluded is you have to put all this together in this unified experience. And there's no way to describe it. So we had to create a way to describe it, and that's applied health signals. And then what it means is we're applying all of this incoming information from our own devices, from electronic health records, which I know a little bit about, from pharmacy records. We're applying all that information and we're presenting it to people so they can act on it. And that's what this engine does. So
tell us about AI and AI.
I will. So Matthew, so the engine that stands behind applied health signals that really drives the outcomes is something that we've termed AI+AI. It stands for aggregate, interpret, apply, and iterate. And it's different from AI because, as you very well know, big data and AI has not solved the healthcare dilemma. It has certainly not solved the healthcare dilemma for those of us living with chronic conditions. So let me walk you through these 4 pillars, describe what they are, and then give an example as to why the healthcare system has not yet achieved what we are doing at Livongo, and then a very clear example from a member. So if we start with the first A, aggregate. Think about this as the ingestion of data. So I think about it as uniquely Livongo data, our real-time blood glucose values, our real-time blood pressure values, the survey data that we understand around communication preferences. How do people want to be contacted? Who do they want to share that information with? And then the rest of the healthcare ecosystem. And this is where partners play a big role for us. So medical claims, pharmacy claims, eligibility data, formulary data, APIs around health trackers, continuous glucose monitors are partners. So that's at the very top of the funnel, aggregating the data. Interpretation of the data. We interpret these data into unique signals. So this is normalizing the data. It's dimensionalizing the data. It's creating those unique combos like you do in a kitchen, right? You have all your spices and you're creating unique little bits and pieces of this to understand the what for clinical outcomes, the how, the when, and the where to influence behavior. The next day is to apply. And so think of these as unique channels that we can reach our members to help influence behavioral change. It also, to your earlier question, back into the healthcare ecosystem, how do we apply these signals back to providers through health summary reports? How do we apply these insights back to our customers, large self-insured employers and insurance companies, to give them the signals that are driving the outcomes for the population? And then lastly, iterate. And this is where we learn. This is where we get faster, we get smarter, and the flywheel really starts to continue.
And let me just say a word about that flywheel, because that's what we love so much about Netflix and Amazon. They know what we want even before we know it sometimes. It seems like that. And all the things we love about the rest of our life, why can't we get those in healthcare? And that's what AI is doing.
So this will probably resonate. So examples of where the reason we called out the 4 pillars of AI explicitly are, for example, big data in healthcare. So here I think about Flatiron Health, I think about IBM Watson. These companies have done a great job at amassing data, and then they run a lot of algorithms on that data, but they don't apply that back to the end users. So they're not really able to impact behavioral change and therefore iterate. The other key component here is the component of real-time data. So in our Livongo for diabetes, Livongo for hypertension, the real-time cellular-enabled connectivity is critical for driving outcomes. Another example of people who are playing in this space on some aspects, but not all, is consumer tech, right? So think about Google or Apple here. These companies do a great job of aggregating data and then applying that data they aggregate directly back to the individual, but they're missing that really important loop of interpretation.
Yeah, they don't have that air traffic control piece.
That's right. That's right. And so it's really this combination of data scientists, behavioral specialists, and clinicians, right, sitting tightly together. An example of where this has misfired is actually, if you look at the Apple Watch, right, has created the ability to track heart rate data and informed a number of people that they're having dysrhythmias, right, to the alarm of these individuals who then go seek healthcare, all because the interpretation was wrong, where it has increased the confusion, the complexity, and the cost in the healthcare ecosystem.
Which is noisy healthcare.
Which is noisy healthcare.
I mean, to poke Apple a little bit, when they brought out the iPod, they actually brought in iTunes, which put a whole loop in there so you get from your device to the music and back, and they haven't really run the back end of this. So that's what you're heading.
That's right. That's right. Not in healthcare. They have not done that in healthcare. That's exactly right. So I'm going to announce today 2 new product innovations within our category of applied health signals. So the first one is a voice-enabled blood pressure monitor. So this is really building on what we shared with you, Matthew, at Health 2.0 around a cellular connected blood pressure cuff. This is the ability around to understand how certain people receive the information, the signals that we're giving them through voice enablement, the ability to interact through voice directly through the blood pressure cuff. The second new product announcement today is this announcement around free medications. So with some of our customers, we've been able to craft value-based incentives where their members, their employees achieve certain actions and their medications are free. They're co-sponsored, $0. So if you think about barriers to achieve health outcomes, access to medications is really at the top of the list, and cost is a real component. Again, trying to decrease the confusion, the complexity, and cost within this noisy healthcare system.
So, and just imagine in both these cases coming together. So someone checks their blood pressure and it's high, and they're now having a voice conversation saying, are you taking your meds? Have you run out of meds? Do you need us to reorder your meds? Fast forward, they might be thinking, I can't afford them. Well, because you're checking, your meds are now free, courtesy of your participating.
And roughly how much might that be to a member per month?
Well, this is free to members.
So it's free to them, but how much they saving if they're not paying for the meds anymore?
Well,
they can be hundreds of dollars a month.
Well, interestingly, in hypertension, the generic meds are not so much, and the copays are what drive it up.
Right.
So that's what makes this unique. And again, it's a new way of making healthcare friendly.
And think about most of us with chronic conditions, 70% of us with one chronic condition have another chronic condition. We have 1 to 2 meds per chronic condition. Right. So you're looking at 4 to 7 meds at $40 a copay. So it adds up for the individual member. So I'm going to walk real briefly just to one step further when Glenn was giving us an example around what this looks like. So I'm going to describe those 2 new product innovations for a member who has hypertension and walk through the distinct 4 pillars of AI+AI. So a member with high blood pressure, elevated blood pressure, at the aggregate level, we take in a bunch of information, medical claims, pharmacy claims, formulary information, communication preferences, real-time blood pressure readings. We then start to interpret that information. And in the interpret layer, what we see is that this person actually responds very well to voice enablement. They're an auditory learner. That motivates them, the voice, the tone of the auditory message. In addition, we start to see that the blood pressure is elevated, and this member hasn't actually been taking their medications. They haven't been refilling their medications at an adequate rate. We then start to apply that. We use the coaches to invite the member into a coaching session. Through voice enablement, we invite them in to have a coaching session. The coach learns that the member is not taking their meds because they cost a lot, right? And so with that information, the coach is able to inform the member in the system that if they check their blood pressure 3 times a month on Livongo, those meds are completely covered. And then we start to iterate. We see that the blood pressures start to come down and the overall health improves, and we're able to congratulate and reward and motivate that positive behavior for the member.
And on that iteration loop, if it doesn't work, we might say, try a different med. Or we might say, and we explore, and that's that learning process. And the more data we now have the largest database in the world of real-time diabetes information. The more information you have, the faster that flywheel spins and the smarter you get.
And the real-time data, Glenn mentioned we had the largest collection. We're collecting 1 blood glucose every second. So think about how many blood glucose values we had by the time we finish with our session here, real-time for our members. And it really is about our members. So I bring this up. We are not changed as a company. Our mission has not changed. Our members, even in the diagram, are at the center. This is why we're here. We are here to empower people with chronic conditions to live better and healthier lives. The category applied health signals is unique and it's new. And the mission around silencing noisy healthcare is incredibly bold. And we believe that we're on the path to be able to do that. We're able to take confusion in the healthcare ecosystem and create that into clear guidance for our members, decrease the complexity and create a unified system. And again, where there's excessive cost, make healthcare more affordable.
Great. Well, thanks, Jenny. Thanks, Glenn. So those of you watching at home or in your office, please feel free to start asking questions in that Q&A box. We're going to talk a bit about that. But let's start with the obvious question. Here we're in Silicon Valley. Some organizations around here have been known for perhaps saying they're doing things they aren't yet doing.
Right.
So you've added an entirely comprehensive suite, because you go back 3 or 4 years, you guys had you had the coaching and you had the device, you probably didn't have the rest of the data science put together, you didn't probably have the interventions, and now you've essentially got the comprehensive part together. What's real and what's coming later?
Yeah, it's a great question. So the good news for us is the AI engine is something that we have been doing. We're getting better and we're getting faster. And the reason I can say that, and you can even agree with me, the reason is because we have hard outcomes. We have net promoter scores in the mid-60s. We show clinical improvement. A1C decreased by 0.8 of an A1C. Weight drop, 87% of our members decreased their BMI by 1 point. And we have documented, published cost savings in the ecosystem. So we're doing that. We're doing it faster. Each member that comes in, each new data point we get, we're able to do it better and to do it faster. But we've been doing it from the get-go.
And for 100,000 members and growing, 600 companies, this isn't a let's test it out. People have been using this for years.
Right.
And that is really the true test.
Okay, we have a couple of questions coming in. Please keep them coming in. So first one, hopefully it's an easy one, but let's combine two here. How long does the hypertension program typically last for members? And then for the new introduction of the voice-enabled hypertension blood pressure cuff, how is that working?
Right, so I can take those questions. So hypertension is a chronic condition, just like diabetes. Once you receive the diagnosis, it doesn't go away. You can't not become hypertensive.
Right.
You can absolutely manage it. You can manage it with weight loss, with diet, with exercise, with medications. So once a member is on our platform, we continue to keep them on our platform so that we can continue to manage them and decrease their complications. The voice-enabled product around the blood pressure cuff is coming soon, the beginning of next year. We'll be really delighted to get to reveal and share more of those features and those interactive points as how members will be interacting with
Can I make an assumption that if I do my blood pressure and it's telling me stuff in voice and I can start a voice that I can connect to a coach pretty easily?
Yes, you can make that assumption.
I think the link between the machine and the human, which you guys have pioneered for a while, is super important.
And the only thing we can't assume is that it is your voice, because people might not want to wake up with your voice. But we're working
you're
on
not
a variety
hiring me to be the voice model?
No,
I was at the conference the other day where the original Siri was there. There's a question about coming in about data. How much of the data is coming from your own platform, the real-time stuff that you control? How much comes in? We've all heard about claims being inaccurate nowadays, other work you put in the AI. In fact, I think our friends at IBM have run into this a little bit. Tell us about how those two data sources are coming together and which you rely on the most.
Yeah, I'll take that. So we have great data coming in from our members, and it's interesting because that data is not just, let's take diabetes, a blood glucose reading. We ask them interactive questions that they're answering multiple times. We know the time that they're checking their blood sugar. We know the trending analysis. And then we compare that to a broader data set. In addition, there's other kinds of devices that are a member. We have 20 different partnerships with other folks who are members of our ecosystem. So we're bringing that data in and we're using that. And last but not least, we are using information from their doctor, from electronic health records, like our partnership with Cerner on electronic health records. And we have partnerships if they're wearing a CGM, a continuous glucose monitor. We have a great relationship with Abbott on their Libre device. So we'll take the data from anywhere. The challenge in healthcare has been not that we have too little data, it's that we have too much, it's noisy. So what we're doing is separating the signal from all the noise. And that's really what we're about.
And so in those terms, what do you think matters the most? Is it what's unique about Livongo? Is it the combination of that, or is it the fact that you're getting the real-time data? If I take one of them away from you, which one would you want to keep?
The good news is you don't have to take one away. And I think it would be like saying, take any great experience and say, if we just took one piece of it. The idea is this unified system. It's an experience. It's not a product. It's not a solution. It's an experience. And that's how we think about everything wonderful in life is an experience. And we want the experience of having a chronic condition to be easier, to be more fulfilling, to be safer, and to keep you healthier. And that's why we apply these health signals, applied health signals. That's what we're doing. But you need every piece of it. And we just want to make it easier to be healthy.
So Jenny, we've got a question about individual motivation and behavior change. So we hear so much about behavior change, individual motivation, and getting people to do specific things. How are your members' goals and options individualized within the system? And do you incent them? I mean, we've heard about free medication today, but do you incent them in some other way?
Yeah, so it's a great question. question. So absolutely the goals are individualized, like to a T. They're individualized both on, what is the condition, what are the medications, where in the journey are they, but also what actually motivates that individual, right? So most of us, it turns out, aren't actually motivated by our biometric data. We're motivated by things that we enjoy in life, whether that be people, whether that be pets, whether that be experiences, right? Most of us don't wake up every day trying to hit a certain number on the scale, and that's the sole driver for our day-to-day activities. And so in terms of incentivizing, there's a lot of different ways that we can promote behavior. Some are incentives, but incentives come in different forms, right? So for a lot of people, if you think about incentives, it's around peers, it's around sharing your information, sharing your success. Some of that is around, people are positively motivated, some people are negatively motivated, right? They like to be told what to do, or they like to do what they're not told to do. So it's really understanding the human psyche at the individual person level to really drive those behavioral outcomes. So this reinforcement learning platform that we have with hundreds of thousands of messages lets us cohort individuals to a really, really small subset so we can understand that individual and drive behavior.
Okay, there are a couple of questions. We have about 5 minutes left. There are a couple of questions regarding, and I'll try and combine them, regarding the relationship with doctors. Okay, so go back, you don't remember this, Julie, because you're too young, but Glenn and me remember the first wave of disease management, which kind of fell apart because the link between the disease management companies, there are a lot of problems that have been solved with technology, but they didn't really have a great connection with the physician. What's the relationship between Livongo, the primary care physician, around things like meds and titration, and for that matter, can they communicate with their physicians through the Livongo system or just with coaches?
Let me take the first part, and because Dr. Schneider can give us a different perspective, but when you have a chronic condition, it's very different than kind of acute care. If you have a broken arm, you need heart surgery, you have to see a physician, a surgeon. You need that. For the day-to-day care of chronic conditions, that's 24/7. So if I had to take my son to the doctor, we had to take him out of school, I had to be out of school, my wife had to be out of school, we had to all go to, it was terribly inconvenient, and then we would get there and it would turn out, hey, you had a great report and there was no activity. So contrast that with knowing that he or she or whoever your loved one might be is healthy because you can remotely monitor them. So there's much of what you experience with a chronic condition that can be done outside the doctor. But what we want to do is keep the doctor informed, in the loop, and again, we want to reduce the noise for the doctor. So we don't want to send her or him every data signal that we have. We want to send them only the signals that say you need to intervene. And that might be the case where you said you need to change the titration, you need to change the medication. What doctor wouldn't want to know that a medication that she prescribed wasn't working for their patient? They would all want to know, but today they can't. In the future, with applied health signals, they will.
Jane?
Yeah, no, I would just add that providers are an important part of the healthcare ecosystem. Their biggest ability is to prescribe medications, right? And so we're practicing within our licensure, and we're prompting physicians and other healthcare providers around what they can do to outreach. So an example of that is we have a lot of providers who use Livongo in their clinic, and they are fascinated because now for the first time, when they're trying to target people to come into their healthcare ecosystem, they can understand who those people are that most need to come in, rather than blanket everybody who has diabetes. They can say, these 10% of the population, we need to bring these people in now. They can double down, and that's good for providers. That's good for patients. That's where incentives really start to become aligned.
Yeah, that's what I call the sort of always on, always monitoring, always managing, always messaging health system that we need to be building, and you guys are right at the root of that. So last question, in a minute, real quick. There's been a big issue of burnout amongst all chronically ill patients, diabetes patients. Yeah. I'm sure some on Livongo as well. How do you think the applied health signals product set and idea is going to change that?
Yeah, so burnout's big in healthcare ecosystem, and I live with type 1 diabetes, so I get burnout. Right. I get burnout as a patient. I get burnout as a doctor too. And it is really what Glenn was describing earlier around this myth of more. It's this idea that more things keep coming at me. I get a device, and then I have to learn how to upload the device, and I have to learn how to upload the uploaded device to my doctor, and then I'm supposed to understand how that connects with this device, and then how to make that medication change. It's a lot. And so the goal of what we're doing is actually to eliminate that and just serve up that little thing that you can do right now to have the biggest bang for your buck in your healthcare outcomes. And so our members tell us, and this is where I'm very excited to be a part of this journey. Our members tell us how much we're changing their lives by empowering them, by having them, asking them to do less to get more.
So it's changing the healthcare experience for better for everybody. That's fantastic. All right, so we've reached the end of our half hour. I want to thank you all for joining us. Many of you asked questions we didn't have time to get to in a couple of minutes. We'll try to capture those questions and I'll answer them later. I'm Matthew Holt. I want to thank Dr. Jenny Schneider from Chief Medical Officer of Livongo, Glen Tullman, CEO of Livongo. They've been launching Applied Health Signals, a brand new platform of AI+AI, a different AI from the ones we talked about. And we're looking forward to seeing more about this as it goes forward in the future. And frankly, building that new platform, which is going to change healthcare and healthcare's experience for everybody. So with that, thanks for watching. We're out now.